we go. Everyone who is attending should have received a pre-webinar survey. Hopefully, you took a few minutes to fill that out, and we will be sending a post-webinar survey out to all attendees, and we ask that you please take a few minutes. Both of those surveys are very quick and easy, and they're very helpful to us in understanding the impact of this. I want to send a thank you out to Mouthwatch for sponsoring this webinar. It's really great to have a sponsor for this type of activity. We're very excited about teledentistry. We look at it as an access issue, and we hope to see it develop and spread throughout the state of Missouri and help with our many oral health access issues. I know there are some people on the line, even from out of state, so I'll give you a little introductory material. The coalition is a nonprofit advocacy agency dedicated to improving the oral health of all Missourians through sound public policy and public awareness. We've had a number of successes over the past several years, including working closely with local oral health advocates, reinstating the Missouri State Dental Director position, and starting the Legislative Oral Health Caucus, and reinstating Missouri Medicaid adult dental benefits, resulting in the delivery to date of about $50 million of new dental services in the state of Missouri, and reducing ER use for non-traumatic dental conditions by about 44%. So that's some introductory material. I will say the coalition does have some financial challenges currently. If you're not a member, we'd love for you to go to our website, oralhealthmissouri.org, and join. We are also interested in donations so that we can keep up our excellent work. With that, I will introduce our speaker for today, who is Dr. Nathan Suter. He has served previously as the Oral Health Director and practicing dentist at Comtree Comprehensive Health Center, a federally qualified health center, or FQHC, in Festus, Missouri. Did that from 2013 to 2018. He was instrumental in starting the dental program at a fast-growing network of FQHC dental clinics throughout Jefferson County in Missouri. He is now the oral health program specialist at Comtree, overseeing the teledentistry program, grant writing, strategic planning, and business analytics. In 2017, he purchased a rural private practice in House Springs, Missouri. He splits his time between Comtree and his private practice, Greenleaf Dental Care. In January of this year, Dr. Suter started Access Teledent, a consulting company to help health centers and dentists start using teledentistry. And I also wanted to note that in 2016, Dr. Suter received both the National Network for Oral Health Access Outstanding Clinician Award and the American Dental Association Dr. David Whiston Leadership Award. Dr. Suter joined the Missouri Coalition for Oral Health in 2014, and he is currently serving as the vice chair of our board to become chair, I believe, starting in July, and he also chairs the conference committee for the coalition. So he's very helpful with us, very active, and we appreciate Dr. Suter, you doing the presentation today. With that, I will turn it over to you.
Thanks, Gary. I appreciate it. I'm going to switch over to my presentation. I've got a lengthy presentation with a lot of content. With the wide audience that we have coming from different backgrounds, there's some things I'm not going to spend a lot of time on. So I left the slides in there. I'll just kind of briefly go over them. If anybody has any questions, feel free to send me a message afterwards. So Gary, can you tell me you can see that?
Not yet.
You see my presentation?
Not yet. Are you hitting that screen share button? Oh, wait a minute. I think it's coming up.
That better?
No, still don't see it. We didn't have this problem a minute ago, did we?
No.
The screen share button up at the top should allow you to do that. You might want to mute your video and then give it another try.
Is that better?
There you go.
Cool. All right. Well, I'm gonna move forward with this then, guys. You guys can put your questions in the chat box if you have any. Again, I'd like to say thank you to Mouthwatch. Mouthwatch is presenting this presentation is sponsoring the presentation for the coalition, and we're grateful for them for sponsoring and helping the coalition out. So Gary already went through my credentials. Biggest things is I worked at a community health center for 5 years and started the program there. I currently still work part-time at the health center, and I also own a private practice. I recently started a teledentistry consulting company called Access Teledentistry, and I thought I'll get going at the health center just to kind of show you my perspective. I started the health center program where we started the teledentistry program at the health center through a grant in Missouri starting in the fall of 2017. Since I opened the health center dental program in 2018, the health center saw 9,574 patients for a total of 22,000 visits. In 2018, there was no dental program in 2013 when I helped start that program, and we have a total of 6 kind of one mobile clinic, 2 fixed clinics, 3 school-based clinics, and 3 portable teledentistry clinics with over 12 dentists and 6 hygienists. In this presentation, I'm going to go through a few things. Some of them I'm going to get in more depth than others, but we're going to go through current grant funding opportunities in Missouri and federally. We're going to do teledentistry definitions and terminology, teledentistry advocacy in case you're from outside of Missouri or you want to know the history of how we got here, examples of current teledentistry programs that I've participated in, indications on why to implement teledentistry, key factors to consider when you are wanting to start a program, and potential uses as you think about the funding opportunities, potential uses for teledentistry going forward. So current funding opportunities. There is 2 state grants in Missouri, a teledentistry grant through HRSA that the state won the award for. So that's one is going to be funded each year for the next 4 years. Funding for supplies and equipment and salaries, no restrictions on who can apply as long as you are a Medicaid provider. And that's for $94,000. The application is coming soon. If you could keep an eye out on the website listed in the middle, Missouri Buys. So that is the HRSA State Workforce Grant. Secondly, going to be released shortly after that, also on Missouri Buys through the state. The state got a CDC state has money for a teledentistry sealant program. So you have to have, it must include a sealant program. There will be one award, and it's a grant, a cap of $81,000. Funding can be used towards salary of educational purposes for the person involved in the grant. Must also be a Medicaid provider. For both the state grants, Access Teledentistry will be providing technical assistance for those grants, as well as on-site training for those grantees that get these grants, and help in setting up and decision-making process of those programs. Also, there was announced 2 weeks ago the Oral Health Infrastructure HRSA grant from the Bureau of Primary Care. This is to increase access to integrated oral health services. There's going to be $300,000 max per applicant, 250 maximum anticipated awards. You must be a HRSA 330 Health Center grantee. It is a one-time funding, and it has to focus on integrating dental care and integrating oral health into services. So it has to have attention on that. They also have a specific sentence in there giving attention to telehealth and virtual dentistry. So that's why this presentation might be pertinent to some people. It includes equipment minor alterations to existing structures, and also training and consulting money and health IT. It does not, you cannot use it towards service provisions. You can't use it for salaries or anything like that. Application is due shortly at the end of April, and the grant will be awarded in September. So what is teledentistry? Teledentistry, this is the definition from the ADA from 2017. It is a teledentistry in a nutshell, without reading these next two slides, is using technology as a tool to do what you already did, okay? It is a mode of patient care for you to provide the same services you would provide in person. It just allows you the tool of sending someone or doing it when the dentist is not physically present, okay? And in Missouri, they defined telehealth, and they specifically included both asynchronous and synchronous communications, and I'll get into the definitions too. So this is a definition in Missouri statute from Senate Bill 579. It is not a new procedure. It is just a new way to accomplish the same results. And the critical thing here to remember is that the same standard of care applies whether you are in person or you're using telehealth. Always remember that. You have to have the same standard of care in whatever program you establish. Two other important legal definitions that can vary state to state. One is called the originating site. That is the location of the patient, the physical location of the patient where the diagnostic data is collected. The second key thing is the distant site, which is the location of the dentist or the provider that is providing the examination. You need to make sure both these things are listed in your notes if you are doing teledentistry. You are listing the originating site and the distant site. A few other critical things to do is the term synchronous, asynchronous. So synchronous telehealth or teledentistry is live and simultaneous using video conferencing. It is the thing that people think of when they first think of telehealth. Using video conferencing, such as a program similar to Skype, but it needs to be HIPAA compliant. And the ADA released a code for that in the adjunctive category called D9995. Okay, the second, which is really the proven model for teledentistry, and the more common model, if you look at places like California and other parts of the country, is asynchronous, which is store and forward. So that is using you are doing the exam and completing it at a separate time as from when the data was collected. And that code for that is D9996. Two other types of teledentistry, when you look at the umbrella, not teledentistry, but telehealth in general, is telehealth that's direct to consumer. And these two, they have no code. They are not reimbursable from any insurance companies, but direct to consumer is like things like Teledoc, where you kind of open up an app and you could talk to a nurse practitioner or a doctor over some sort of app. A lot of insurance companies include these kinds of things. And that is called direct to consumer. It is different. And then there's also things like live patient monitoring. So usually that has to do with management of chronic diseases. So insurance companies will sometimes supply people with stuff from their hospital that they wear and they take to monitor them remotely. So that is called live patient monitoring. There is no current code for that, but there are future possible applications for that in dentistry. Another couple things I want to get into before we dive into examples is data collection technology. The critical thing here is to look at your entire program and evaluate what do you currently use, if anything, if it's not from the ground up, and what would work within your current IT infrastructure, as well as what works in the setting that you're wanting to perform teledentistry in. And so here is a long list of different ways you could collect data for technology, and I'll get into how we've done it in the past for the programs I've been involved in. But every program will need to evaluate these and the capabilities that they need and the funding that they have. And it's really crucial to have the data collection that is needed to have the dentist feel comfortable that they're making an examination. Without the proper digital diagnostic data, dentists cannot complete an exam because, again, we have the same standard of care. Another part key to the after the hardware is the software. So sometimes, really, the majority of stuff is going to take place in the electronic dental record. But you also have things like imaging software and programs that allow you to sync images between softwares, and you have to have conversations around things like having physical servers and laptops versus cloud servers. What kind of internet connection are you talking about? And what kind of device you're going to have to hold the software. So in Missouri, teledentistry is legally permissible due to a rule change that the Missouri Dental Board instituted in January of 2018, which was they added that second bullet that you see onto the definition of patient of record. They took what was a patient of record and they added the second long run-on sentence called that allows for the patient to become a patient of record of the dentist when his or her hygienist is out in the field or at the office when they're not there, things like that, and is able to collect the diagnostic data. That patient then becomes a patient record. So it is regulated under the general supervision rule in Missouri. Also, teledentistry is a covered procedure in Missouri Medicaid. Medicaid will reimburse for the exams and x-rays and cleanings while using teledentistry. There's some limitations on when the cleaning can take place, depending on what kind of setting that the patient is in. There's also, it will pay for this code for children, pregnant women, and patients in skilled nursing. They are D995 and D996. Private insurances do not cover it, but there is a parity built into the law so that they have to recognize in-person and non-in-person visits to healthcare providers. They are not mandated to reimburse for these new codes, but Medicaid did decide to make that. So Medicaid reimburse at $14.60 for store and forward or live simultaneous. I'm not going to get into this a little bit, but I'm going to include it when we send out the presentation for people. But this just kind of goes through where in 2010 is when the virtual dental home model, which is where I became aware of teledentistry, took place in California, and kind of outlines how we advocated at the State Dental Board. In 2014, I presented at the State Dental Board, and then worked with the MDA and the other and the coalition and other parties to then work with the dental board to help make it clear we were able to do teledentistry. So these three sides I'm not going to get into because we're limited on time. But a lot of grassroots advocacy to get that happening. Why would you consider teledentistry? Well, your needs may vary, but things that teledentistry can be applicable for is temporary provider shortages, geographic provider shortages, increasing access to locations and certain locations, or increasing hours, increasing the amount of services that can be delivered through an outreach program that you may currently have that has limited scope. It could be increased. You could also decrease the travel time for your patients if you're looking to do that, and have just more tools for early intervention, and could bring dental care to rural areas that need some economic development and need access to providers. Also, teledentistry visits, particularly in a portable setting, have a lower cost and sometimes can have a higher reimbursement by category versus other dental procedures through insurances. This is some data from the Health Policy Institute that just shows where people are going and why we need to kind of think differently about ways to reach people. So between 2006 and 2012, there was a total 7% decrease in total visits to dental offices um, in general. But meanwhile, 5% increase in the U.S. population and a 9% increase in the number of dentists. During that period of time, there was a decrease in dental office visits, while by 9%, while at health centers, almost a 74% increase in visits for dental visits. And at hospitals, there was almost a 20% increase in people visiting the ED for dental pain. So it just shows you the way that the system, it wasn't meeting the demands. And so teledentistry can possibly give us some options on how to reach people. So this is also just an example of the cost of delivering a service in different settings versus the type delivery model. So lowest cost is doing nothing. Then there's like a screening program, and teledentistry fits this niche between upgrading a screening program, but you don't have to bring the dentist out like in a regular portable dental program that might bring a dentist out or a mobile van. So and the most expensive thing being a hospital and specialists. And the last thing to consider is that all we have to do to decide is what to do with the time that's given to us. And I say that because the thing about teledentistry is you're getting smarter with your resources. When you're using teledentistry, you're able to take some of the most expensive parts of the dental visit and be more efficient with it. Mostly the dentist's time. So you are not building the visits around the dentist, and when the dentist is available, you're going out to the patient. Sometimes you're going out most of the time you're going out into the community. And even that, you don't have the overhead of a clinic, an expensive operatory or building full of operatories that are better suited for surgical procedures than they are for doing routine checkups. So here's an example of our journey through teledentistry at Country. So again, I started Country in 2013, and in 2017, we got Missouri Foundation for Health grant that allowed us to kickstart a teledentistry program before it was billable. So we were able to start the first teledentistry pilot in Missouri utilizing portable equipment. We've since trained 12 dentists, 6 hygienists. We've gone to 33 schools. We've had gone to one nursing home where my grandma lives, and we've gone to the 2 primary care offices at Country, and we had 2 fully integrated exam rooms that were at least 2 days a week dedicated to teledentistry assessments. And the color's off on this for some reason, so I apologize. But that last part about the integration part, we had the oral health primary care oral integration program where we used teledentistry. We had a hygienist who started this before we used teledentistry in 2016, where 3 hygienists were trained. They went to 2 primary care offices at the health center. There were 139 teledentistry exams completed this way. Some people just came in for a consult and then they were sent in, but the 139 had full teledentistry exams. Services were offered at the medical office 1 to 2 days per week, scheduled with the hygienist for an assessment, and then the hygienist was also available to do oral health consultations for the doctors and the nurses at the primary care office. We actually ended this program in 2018 at the health center because we had to stop taking new patients, and this was our primary way to get where new patients went through. So we had to shut it down because we were shorthanded on dentists who could do follow-up care, so we discontinued seeing new adult patients for around a year, and hoping to reboot the program here shortly. Here's some examples of the outreach teledentistry that we did. We used a van and brought all that equipment, as you see, to different schools. We also, this is a dashboard that we use to evaluate the program, and that is from up until February, end of February this year. we had seen a total of 1,149 teledentistry examinations for an average of around 67 teledentistry exams per month during that period of time. And you can also see that about 25% were uninsured, and a little over 50% had Medicaid, and then some had private insurance. And this was all at the health center. Advance here. And then also at my private practice, I started using teledentistry in December, mostly to increase the hours of operation and make sure that the hygiene chair had availability. So it's about 20 extra hours per month with a 22% increase in office hours for the practice for the year. And an example was I had the flu and had to cancel all my patients for the day on a Tuesday. And I was able to keep the 5 patients scheduled in the hygiene chair that day. And all of them, we just called them up and said, hey, doctor's not going to be here. He could do teledentistry. He'll review your record and he'll call you if he needs to do anything further or talk to you about his treatment plan. And all 5 of them said sure, and there was no problem. Worked out great. And that's one where it just comes in handy sometimes. You don't have to inconvenience everyone. So now I'm going to get into, if you're starting to develop a teledentistry plan, what Access Teledentistry, what we like to say, we have a 4-phase approach to teledentistry. So as you're kind of thinking about starting a program, you can think about these areas. So the first part is that care coordination encompasses everything in teledentistry. The second part is the data collection. The next is the examination, and fourth is the critical part of follow-up care. And around all of this is a framework that encompasses it, that allows it all to run smoothly. So you have operations and technology, you have legal regulatory things to consider, financial and sustainability things, as well as having a training and evaluation piece. So the first thing that we like to tell people is through care coordination, there's 4 key areas. You have to understand your patient's social determinants for health, and what they're looking for. Is transportation an issue? Is that going to be an issue for follow-up and for referral? Is that implicate different ways to approach the care that they might need after you've seen them for the teledentistry? Also helping them with understanding insurance. A lot of times when you're doing teledentistry in certain new areas that never had access to dental care, people aren't used to having to figure out the dental care system, and their knowledge is very limited. So it's important to understand social determinants. The next is patient education. The hygienist needs trained, and the care coordinator, if they're not the same person, how to talk to the patient about their expectations, so that when the hygienist is talking to them about what they're looking for in their care, like are you looking for, I'm ready for dentures? Is it looking for, I'd like to save some of my teeth? Or the hygienist and the doctor need to be tightly calibrated so that they can have that, the hygienist can have that conversation that the dentist usually has on what the patient's thinking and what's doable. So it's very critical for patient expectations to be communicated between the hygienist and the dentist. The next thing the care coordinator does is navigate and referral, and she does that after the exam and all that kind of stuff. The next part is data collection. So data collection, the critical part is figuring out your IT around radiography and photographs, doing the dental chart, and then a very thorough system of documentations. The big thing about teledentistry is that in an office, everyone's together, the whole team's together. In teledentistry, you might have, especially in a big health center or a hospital or something like that, you've got people in different parts, and you need to have a clear protocol on how to communicate all the things you need, so that if somebody needs something, they know where to find it, or they know who to talk to. Here's some examples, just traditional full mouse series. Saved, we use Dexis in this situation. One thing that I've learned is that intraoral photos sometimes aren't enough. So we implemented both at Comtree and at Greenleaf in our practice, we do a full mouth orthodontic series of photographs so that the doctor can see from the zoomed out perspective what teeth are there, how does their bite look, what's going on here and there, and then you could zoom in on the problem areas after that. And between the x-rays and these pictures, you can get really close to having a final diagnosis when you add in the notes that the hygienist writes. So here's an example. The hygienist charts the teeth that are there and existing restorations. Tiffany also put in here suspicious lesions for me to review, and I either add or take away suspicious lesions. So they marked in black so that I know to look on those pictures and look in those x-rays that she saw something there. And then we move into the examination part where the doctor reviews all the diagnostic data, comes up with a diagnosis, takes the diagnosis and creates a treatment plan. And in the treatment plan, then communicates what's the next steps. A lot of people ask what it looks like, and this is what it usually looks like whenever you're doing teledentistry. If you're a dentist and you can relax and do it from home. That's what radiologists do all the time. But that's the next part. Here's the picture for the intraoral zoomed in photographs of the teeth. So these were the areas that she had marked in the diagnostic data capturing part where there were issues. So those 4 teeth have problems with them. So she took pictures of them so I can see a little clearer. I then took that and I layered on top of it a treatment plan. I also had put some watches because I had actually noticed some things that I'd like to follow up on at the next recall. So there you can see a couple watches on there. One example of good communication, this was the first week we did teledentistry. One of the hygienists at the health center, Renee, did a great job. I opened the tooth chart and I saw that this patient had a screening score of low caries risk. But she had a watch. All the teeth charted had no restorations or indications except a watch. So then I looked at the x-rays first, and you could see in the x-ray above, I circled it in yellow, what looks like possibly occlusal caries on top of there. And then took a look at the picture of it and circled that in yellow as well. And I didn't see anything really concerning in that photograph. But then when I looked at her detailed notes, she wrote, Number L has occlusal wear, smooth depression, not sticky with Explore. I was 100% confident that that's exactly what was going on, and there was just full circle. She communicated to us 3 or 4 different ways in this one example of this one tooth, and that's how detailed you can get when you're calibrated closely with your hygienist. The next stop in our 4 phases is the follow-up. It's critical you have a follow-up plan when you're implementing your program. So you need to have a full thought out process of what do you do with the patients after you do these teledentistry exams. The first thing what we like to do is flag urgencies. So urgent patients get bumped up immediately. The next day they are, or sometimes the same day, they are communicated with. The parents called. In a school setting, the nurses is in communication with all that. So urgency, we do that off of flagging patients in the record and then running reports, and then a follow-up list is ran. The next thing to consider is recall and putting people on a proper recall. Figuring out what treatment needs and scheduling the treatment. Some people, and that lends into the care setting. So we at Comtree delineate, here's an example of a report for the care coordination that we do and how we follow up with people. Don't have a lot of time to go into it, but some people that are transported by a nurse, and some people are seen on school. Some people we come and follow up with. Um, and that care coordination piece is part of what we teach you on how to set up your program so that you can, we code using ADA or care coordination codes so that you can schedule follow-up appropriately. The next thing that I'd like to get into is possible applications for teledentistry. So there's multiple different care settings that you could consider when you're developing a program. For this section, I'd love for us all to just think outside the box a little bit, okay? So each of these slides, next slides, are just potential ways you could consider doing a teledentistry program. Some of them might not be applied to you because you're in a different state or you are in a different organization where it wouldn't apply. Or maybe you're a private practice, or maybe you're a public health. So some things might not be applicable, but we're going to go through each one of these scenarios listed in this list. So the most common way is a school portable program. So you would have hygiene and support staff go to a school, use portable equipment, unload and load. They could deliver preventive care. They could collect teledentistry data. An off-site dentist would review the exams and do the examinations, and then on-site follow-up care can be offered. Hopefully, on-site portable care can be offered, but then if not, follow-up care at an office is also important. And for each of these, I kind of came up with just a brainstorm of some things, a checklist for you to think about that you would need to implement each of these. Another one is nursing home portable. So we both these first two we've done at Comtree, and nursing home we did a little different. Hygiene and support staff go to the nursing home, and they keep a cart with equipment at the nursing home, and they go there 2 days a week. Hygiene does, and teledentistry data is collected, and cleanings are done after the exam's completed. The offsite dentist performs the exam. The dentist would go and use this wheelchair tilter in the picture to go and do follow-up care for some things, and other care was coordinated because lots of nursing homes have transport to medical visits and dental visits. So one of the kind of big differences in this one versus the other checklist is having a mobile dental cart, a mobile cart, as well as a wheelchair lift. Another thing to consider is mobile optimization using teledentistry. So assessments and prevention. A lot of vans go to schools and they're there for a week or 2 weeks, but you could consider using teledentistry if you're shorthanded or you want to retool the program, make it more efficient. You can do assessments and prevention the first few days without a dentist being there, and the dentist completes the exams remotely before that person even comes to the mobile clinic. The patients can be triaged so that the dentist only physically sees that patient that needs treatment. So some of those patients, you have 100 kids sign up for the week. A certain percentage of them, the dentist doesn't even have to see. They can just do the exam and they're off there. They don't have to come back out of class another day. So with this, it's going to require new workflows to be developed, and I've got that in there twice. Another one's like a mobile portable hybrid. So depending on the volume and the demand on the mobile unit and how much treatment is needed, those mobile units are great for treatment. And if you have a backed up amount of schools and you want to implement something, you could get a portable van like the one shown before, and it goes out ahead 2, 3, 4 weeks out ahead of the dentist, and the dentist is always in the mobile van trailing school to school behind them. So that's just an idea of a different way of doing things that you could use as a potential way to implement teledentistry. The next one is primary care integration without a dental hygienist. So in this Yeah. In this scenario, you would have an MD or a nurse practitioner that collects the data, stores it in whatever way they're trained to do it in agreement with the dentist, and then the dentist reviews the exam. In Missouri, the dental board regulates the dental practitioners, okay? So they're going to regulate the dentist to make sure that they're completing notes and stuff on examinations for their patients that are adequate. And if you're able to get diagnostic data from a medical professional at a primary care office to complete what you need, then you could do that. So I heard an example of a dentist that wants to do this at a health center where they've got a big oral health champion in the medical department, a nurse practitioner, that wants to have an intraoral camera so that if he sees something suspicious, he can just take a picture of it, make a note, forward it to the dentist, and the dentist could do, in that case, a limited exam for that patient based off of the outlined criteria that the dentist would need from that medical provider. And that would give that patient an immediate consult that they don't have to then reschedule with the dentist and come in later. You're not going to get a detailed full exam off of this model, but you're going to also be able to use it for limited exams and consultations, and to help with the referral process to kind of keep things going and to cut down on that time between appointments. But the critical thing we learned doing medical integration is it requires full buy-in by the medical department and the dental department so that they can work closely together. If things are too siloed, it will be a very hard uphill battle. Finally, primary care integration with a dental hygienist. So this is what we did at Comtree at 2 locations. Hygienist is on site with medical and behavioral health. A medical dental assessment room is used. And in this case, it would be nice, learning from what we did before, for there to maybe just be a cart. And the hygienist is able to kind of go in and out of different rooms, because we had a designated room and then that took up a medical room. But if you had a designated cart, that might be a good option to go. And you're also available for teledentistry, but you also could be available for doing, someone in another room says, hey, I got a kid that mom has a question. You could be in there for education and referral, or maybe an education that turns into an exam, a teledentistry exam. But the RDH needs fully integrated into that medical office, fully integrated with the team, needs to be part of the team, needs to be in team meetings and staff meetings. And what we found is that you can't, our hygienist went there and was required to do a lot of stuff on her own, including making appointments and follow-up appointments. So if you're going to go to this model, I would include into your planning the appropriate support person that's there to support. Just like in an office, the days that the hygienist is there, she needs a support person to help with appointments and checking people in and making follow-up appointments. Another potential use is emergency room diversion. It would be great if a hospital could have the hospital staff capture diagnostic data, and the hospital provider makes a note, a detailed note on agreement on a template that shows what's needed, uploaded through a secure system, and a dental exam can be done to provide, can be a dental exam or consultation can be provided by a contracted dentist or a dental residency program. Some of my friends that have gone through GPR said teledentistry would be great, because then I don't have to come in at 2 in the morning for a patient that I didn't really need to come in at 2 in the morning for. I didn't have to get up. I could just fire up my computer, give them the consult they need, because a lot of times they would come in at odd hours and then they couldn't do anything and they needed to come into the clinic anyways. The teledentistry provider can then make that decision quicker right there, and you don't have to waste a lot of time and resources. And you could give the medical team at the emergency department the power to help make the appropriate referral. If a person has a toothache or complaining of toothache, you might be able to parse out any opiate seeking patients as well, because you could confirm periodontal abscess, which is not always captured in a panoramic x-ray if the hospital has one. Also, there could be a case for having just a hospital oral health access program where you have a hygienist employed by the hospital or contracted, partnered with the hospital, where you have a teledentistry cart and the person's available for all departments or certain departments that have high need for it. Maybe the cardiology unit or or orthopedic department or things like that. Maybe even the OB and the pediatrics. So there's a use here where a hospital could possibly use an oral health provider using teledentistry so that exams and consultations can be completed and followed up quickly. Another case is for hygiene extended hours. So like in my private practice, we use the teledentistry to extend the hours on the days that I would be out of town or I would be on vacation or had a sick day, like I had said. So using teledentistry, you can implement a program where, for example, we're going to do another evening a week soon because at my private practice, the most popular time for checkups or recalls are 5, 6, 7 o'clock appointments on Tuesdays. So we're considering even adding another late night every once in a while, or possibly even a Saturday, because patients ask for those, and those are the times that are booked out farther. So you could increase access by doing that, and that could be at any existing clinic. Also for dental shortage. So if you have like coverage for during maternity leave or coverage when you're waiting for a new dentist to be on board. Let's say say it's the fall and you're going to get a new grad, but it's not going to be there till July. You could hire a dentist using teledentistry to contract and fill some gaps in your schedule so that the hygiene department can keep seeing their patients on recall. And maybe you're able to get treatment coverage, at least emergency treatment coverage or some treatment coverage in the interim, but you're at least able to maintain the recall system. Maybe your relationship works out so well with the teledentistry dentist that you could say, hey, this is working really good. Could you come in 2 days a month to do some treatment even? And you could use this as to build relationships. I'll go back to that one. One kind of interesting thing was we had a dental shortage at Comtree, and for our outreach program, one of our dentists that was doing teledentistry was from Hawaii, and she worked for our health center for 3 years. She was moving back to Hawaii to work at her mom's private practice, and we were able to talk to her about doing 1 day a week, doing teledentistry. She was doing teledentistry exams for our outreach program from Hawaii for about 3 or 4 months until we were able to get our new dentist in. So that's just an example of how you're able to leverage this to maintain efficiency and maintain access using teledentistry. Another thing is specialist consultations. You could use this to alleviate transportation issues or eliminate unnecessary trips from a rural area to an urban city where maybe the specialist is or the specialty hospital or residency is. So it could allow a specialist to reach those more rural areas without having to open second locations or things like that. A dental office could even collect the data and be able to offer this service to their patients so that they don't have to go in for the consultation. I could see a lot of use for this for maybe a simple extraction or a single tooth extraction or maybe ortho consults or things like that. If the dentist at one location in a rural area has access to the specialist and has a good relationship, maybe they could work something out to work together so that they can offer this service to their patients. And the patients will love you for you to save them half a day or a full day trip out of their way because they're comfortable in their home clinic. And that's where I think, especially consultations, is key. There is a clinic in New York that has a pediatric residency program that I think is 3 hours away. And since 2010, they've been doing teledentistry consults on their pediatric patients from different area health center locations or health departments, and it saves those patients a trip, and they talk to the parent and they get them geared up for their trip to the city for the sedation visit to where they do that. And it saves a lot of time and effort and money to do those kinds of things. So with that, we've got 9 minutes left. I really appreciate everybody's interest in teledentistry. Again, here's my contact information. If anybody wants to reach out, you can send us an email. You can also tell Gary, and he can connect us. And I'm excited to talk to anybody that wants to know more about teledentistry.
Great. Thank you so much for that excellent presentation. Lots of great information in there. We will be taking questions since there are so many people on through the chat. There are a couple in there that I'll cover here in a second. But I wanted to note, while maybe you're formulating your question, that the coalition is funded by memberships, donations, and grants from the Health Forward Foundation, the DentaQuest Partnership for Oral Health Advancement, and the Missouri Department of Health and Senior Services. And let's see, Deborah asked, I would like to confirm that the hygienist can establish records for new patients for private practices as well. Are you able to respond?
Yes, I'm here. Can you hear me, Gary?
Yes.
Cool. Yes, in Missouri, it is under general supervision, and dental hygienists can establish new patients for the dentist under the State Practice Act. So if you read that part of the Practice Act, they added that into the definition of a patient of record. You are when your hygienist sees that patient, you are establishing them as a patient of record. Now, they can't do any preventive care at that appointment unless you do a live teledentistry video and you establish them. You make that diagnosis for that. Does that make sense? So, but yes, that should answer that question.
I think you have answered the other question that came up in there. So, are there other questions that other people would like to pose? Please type them in the chat box. We still have a few minutes. Well, I don't see any. So.
Great. Well, if anybody, again, has any follow-ups or like any more information, feel free to send them some message, and excited to see more programs use teledentistry.
Great. Yeah, and you can contact us through the email that you use to register for this, info@oralhealthmissouri.org. And we will possibly have a recording available of this later. We are also talking about doing a repeat of this webinar. We had many people who asked to register that well beyond the capacity of our webinar software, so we're probably going to be looking at a repeat, and we'll get word out about that as well. So let's see, we got a general comment, more information about the grant. I don't know if you can provide more.
Yeah, so I'm not sure which grant. There's 3 grants, that 2 for Missouri only and 1 for HRSA. So the 2 Missouri grants are going to be available from that website in the slideshow, and I think Gary will be able to send that slideshow out if I email it to him.
Sure.
You should be able to find it on Missouri Buys. It's the state's. It's the state of Missouri's processing website. So you can apply to that. They are not released yet, so we're hearing that they should be released in the next week or two. And then the HRSA grant is available right now to health centers, and that grant is due on the 22nd of April. And whenever the Missouri grants open, you have a month to complete those applications.
Great, thank you. In a school setting, if a child is seen as a new patient for the initial visit, can the hygienist complete prophy preventative care at time of initial exam? Good question.
Yeah, so this is where it gets a little different. So if a dental hygienist under a public health setting can see initial patients, and perform prophies and preventive care. If you are not in the classification of a public health setting, which means you're not a health department and you're not a community health center, and there's one or two other things that would fall into that category. You have to have an exam first. So you have to complete the exam if you do not.
Okay, great. Well, type quickly if you have any other words.
Great.
We got it. Okay, thanks there. Just pausing for a moment to give people an opportunity to ask another question if they'd like. I appreciate everyone tolerating being muted. It's just so many folks that we'd have distracting amount of noise in the back. So, all right. Well,
thank you everybody very much. Appreciate it.
Yeah. Thank you, Dr. Suter. Excellent presentation, and thank you all for attending. And please look for notices in the future about additional programs in the Missouri Coalition for Oral Health lecture series. Everyone have a great afternoon. Thank you.